You're watching Reality Check. We appear to be at an inflection point for the devastating second wave of the coronavirus that tore through India. The daily new cases have fallen from a high of 4 lakh cases in the middle of May to now just over 1 lakh new daily cases, and that's why you can see that curve starting to dip down in the past few weeks. 1 lakh cases is still high though. Deaths again have fallen from close to 4,000 deaths a day in the middle of May to a figure of about 2,000 deaths daily. That's still again high, but it has started to fall. India's positivity rate, which is the rate of the infection, has fallen from a peak of about 25% to around 6%. But it's unclear if the worst is over given our faltering vaccination drive, which after a healthy start virtually collapsed, and as that graph tells you, has just started to pick up in the past fortnight or so. So that's one of the concerns about where we stand with the second wave and what's the road forward, because we have high infections but a low vaccination rate. If you look at the total number of cases, India is right up there with almost close to 3 crore cases, just under the United States when it comes to the total number of cases. But if you go to the next slide and you look at the total number of vaccination in terms of the percentage of population fully vaccinated, world versus India, there is India virtually right at the bottom with just 3% of the entire population fully vaccinated, below USA, Italy, Germany, France, Turkey, Brazil and so on. Also, the sharp variations across India are a worry, with some states reporting high cases even now and others starting to recede. If you look at the number of highest daily cases, it still largely seems to be concentrated in the south and the west: Tamil Nadu, Kerala, Karnataka, Maharashtra, Andhra Pradesh, Odisha and West Bengal and Assam also, and Telangana reporting high daily cases. Again, there's a variation when it comes to vaccination as well. There are states that are doing a better job and others which are not. Look at these states. These are the states with the lowest percentage of vaccination coverage. Bihar just over 1%, UP 1.5%, Jharkhand only about 2%, Madhya Pradesh, Meghalaya, Assam, Manipur and Nagaland, and also Punjab, going all the way down to Tamil Nadu, just between 1 to 3%, 2.5% coverage, compared to states which are doing somewhat better, where the percentage of population is better covered. Those include states like Tripura, Chandigarh, Gujarat, Kerala and so on, where there has been a better coverage of the vaccine. All right, joining me tonight on the show, we have with us Dr. Vikram Patel, Department of Global Health and Social Medicine, Harvard Medical School, Shobhana Kamineni, Executive Vice Chairman, Apollo Hospitals Group, Dr. Shashank Joshi, member COVID-19 Task Force, is with us, and we're also hoping to be joined by Dr. Jayaprakash Mulyal, who is a leading epidemiologist. Let me just start with you, Vikram Patel. I know that you are joining us from a distance. You are in America as we speak, but just looking even from that vantage, Vikram Patel, at the overall curve or arc of the numbers in India and the way it's playing out, what are you seeing? What should we be worried about? What should we be, if at all, hopeful about?
Thanks, Srinivasan. First of all, I have to say, speaking from Boston right now, I just think what a contrast there is between these two countries that I live in, India and the US, in terms of where the US is right now and where India is right now. And it's really remarkable that exactly about 6 months ago, the roles were quite reversed. It's important to remember that. Back in November, at the time of the federal elections in this country, there was a very, very serious wave. It was the second or third wave, depending on where you were in the US. Whereas in India, we were reopening because there was the end of the first wave. But what the US did really quite remarkably is during the period after that second wave, there was a massive drive to increase vaccination rates. And
right.
And today, about 60% of the country, and of course there are, the US and India are very similar in many ways. There's huge state level variations. But on average, about 60% of all Americans today have been fully vaccinated, or at least received one dose, which is in itself actually a huge amount of protection. And I think that has in fact allowed American societies to reopen almost completely. In many parts of the country, there isn't even a mask mandate now. In fact, that's a federal change. There's not even a mask mandate if you're fully vaccinated. And I think this week we can draw on this experience to know that the way to protect our India's people is to make sure we put the full throttle on the vaccination. And of course, I'm sure we'll discuss some of the challenges that we're going to face. But let me also say one more thing. Vaccine hesitancy is not only in India.
Right.
Something we're seeing globally, and I think we need to learn from one another on how we can address vaccine hesitancy.
Sure. No, vaccine hesitancy, I'm sure, is pretty universal. Vaccine shortages of the kind that we're facing in India is appearing to be quite specific to India. Other countries are also facing a vaccine shortage, but ours appears to be worrisome, particularly because it could be largely mismanagement as well. But we'll come around to that in a second. Shobhana Kamineni, from your perspective, just in terms of the pressure at your own hospitals, are you starting to see some of those numbers when you see the graph starting to fall, starting to dip? Is that getting reflected in your hospitals? Has the pressure started to ease somewhat, or is it still quite tense?
The situation has been tense for the last almost 20 odd months. But definitely in terms of this wave, we're seeing that the regular COVID beds, the pressure has eased. The ICUs are still full. And the people coming in are still sick, and we're getting them from the hinterland, from different states as they come in. So I don't see that easing. We cannot say that this wave is over.
Okay. The ICUs are still, sorry to jump in, your ICUs, I mean, you're talking of, because you have hospitals in almost every major Indian city, these continue to be full.
Sure, all over. And I think it's not just from the local area, but they come in from other states, from the hinterland. So we are seeing that this wave, please remember, was widespread, deep, and it's not over. But what we are looking at, I mean, as a healthcare professional, I think that we've been through too much horror for us not to think of what we can do to mitigate the third wave. And that's what I think we should, many of us are looking at. You spoke so much about vaccines, and I think there's nothing that, that will get us to a point where we can mitigate the third wave like vaccines.
Right.
But I also think there are a couple more points, and when we get to it, I'd be happy to answer what we think it is. But right now, this wave is not over.
It's far from over. Dr. Joshi, because we've had this conversation now with you for all through this entire difficult time, and just I think a few days ago we were on talking about the importance of vaccination, but how states that have been at the front line of the virus like yours are still struggling to get enough vaccines. So in a sense, with Maharashtra, would you say that's where the challenge is? Because the numbers have started to drop off in Maharashtra to some extent. So is this vaccine shortage, in a sense, a bigger problem than actually the infections?
So, Srinivasan, very clearly, vaccine shortage continues to be a challenge for Maharashtra and rest of India also. I think things are getting better. Today was the first day where we saw both public and private hospitals in Mumbai getting the vaccines full throttle. So
that's
at least
great.
I am seeing some early signs of some availability which is getting pumped in, which is a very reassuring thing. Having said that, I agree with, ma'am, that, the hospitals are still full and there are a lot more sicker patients staying a lot longer in the hospital. The length of stay in the hospital definitely has gone up this time. And that's not something which we are happy about. We are far from over. Mumbai and Maharashtra has a thick tail. So, you see the rapid rise and the rapid fall which occurred in Delhi. Compared to that, say you look at Mumbai and Maharashtra, they always have a thick tail which remains. And, therefore, easing of restrictions are proportional to the degree of the population saturation with vaccination.
Right.
And therefore, we need to, I endorse with what Vikram and ma'am is saying, that we need to definitely not, we really have to go full throttle on the vaccine. And I wish and pray that in the next 3 months, we almost are able to vaccinate 1 crore Indians every day. And I think we need to do something to get our stocks on board. So I think I think whatever you may say about COVID appropriate behavior, that's mandatory. I mean,
sure, but vaccination is important, no doubt. Okay, Yeah, Dr. Jayaprakash Mulil is here with us. He's, of course, CMC Vellore and one of the country's leading epidemiologists. Great to have you on, Dr. Mulil. Dr. Mulil, just to get a sense from you that everyone obviously around the table believes that vaccination is obviously key, but let's assume, Dr. Mulil, that we are not able to ramp up in the way that we have wanted to because there are acute shortages and it is taking time to ramp up production and import vaccines. If we can't ramp up to the fullest extent, but we're still kind of sputtering along, even then, will we see the sort of the numbers start to fall automatically, or is that not a given?
This particular, I hope my voice is clear.
Yes.
I had a technical problem. But it's important to remember that this transmission of the virus, if you try to attempt by vaccination, it may not be the most smartest thing at the moment. The reason is you will find, despite vaccination, transmission going on. A priority must be in the hospital, where your mortality has to be cut down with efficient management, because that is the only hope we have. There's no vaccine available. Now, our focus should be in hospital, other in supplies, other in staff, and are we taking care of them? Real care. That's number one. When it comes to the virus transmission going on, it is frightening in certain areas, but also it's coming down in other areas. Each infection also is like a vaccination. There is an immunity developed in people. We will not argue now how long it will last, but it is of help temporarily at least.
Okay.
And that should not be forgotten. So those numbers that we count also are temporary vaccination at least. So in our calculation of disease control, it has to be filled. By the way, the current evidence shows the infection-induced immunity is quite good, excellent in fact.
Okay.
So once you put in that factor, we know our section. With vaccine, what I expect to happen is sudden fall in death, not transmission. And that's why vaccination I miss so much.
Okay. Vikram Patel, in a sense, the same question to you, because, the idea that we would be able to ramp up right now, we're vaccinating on the average of about 25 odd lakh doses a day. The government has said that we'll be able to hit 1 crore doses a day in the next few months. It's not clear if that's going to happen. In the event that we're not able to hit those numbers, again, do you think that the virus organically, the infections and deaths will start to come down, or that's not an assumption that we should be able to draw any comfort from?
Well, no, I think Dr. Mulil is exactly right. I think every wave, even before the vaccine, came to an end. So, this is the nature of epidemics of infectious diseases that are highly infectious. I mean, the ones that are, and this particular variant, we now can safely say, even though data from India is actually not that much, but we can safely say or assume that the highly infectious nature of this variant is what's really driven this sharp incline that we saw in cases, much sharper than the first wave, right? And I think what that simply means is that, as Dr. Mulil rightly points out, is that you've got infection-induced immunity that has occurred very quickly in very large sections of the population, and therefore the decrement that you see is also equally sharp. And that's just the nature, that's just the basic dynamics of every infectious disease epidemic. The question is, how long will this immunity last? I'll tell you what, I think we do have a golden window of opportunity to actually achieve vaccination coverage, especially targeting those who haven't been exposed, and then reaching out to everyone. Maybe that is a strategy that people can think about, which is that if you've already had the infection, maybe you can, and if there's a shortage of vaccines, how do you prioritize those who are immunologically still vulnerable?
I see. Okay, that's interesting. But one thing about the vaccines, Shobhana Kamineni, I wanted to ask you, and this is something that you must have also heard, that there's been some rumbling from state governments and other quarters that there is an acute shortage of vaccines, but because of this government's very fragmented policy of how the vaccines are distributed and bought, private hospitals and private entities are able to get better access to vaccines than governments, which is why in some cities and states, private centers are open, but government centers are not. Is that a fair charge? Or is that unfair?
Not really, because you know, every one of the vaccines made in India, they have the drug controllers sitting in their facilities, and all the lists of who it gets prioritized to it goes to the center. So they know exactly where these doses are going, and only 25% is allocated to the private sector. And I don't think that this is something that anyone should be talking about, because what we should be looking at is how do we get more doses in there? How can we vaccinate more people? That's the problem statement.
Okay.
Not who's getting what.
So you're saying this is an important point, which I think people need to understand, that there is a representative of the government drug controller of India sitting in each of these vaccine manufacturers, whether it's Serum, whether it's Bharat Biotech. They are playing referee, saying, you know, who gets how much. So to that extent, you're saying it's wrong to make this sort of charge of partiality one way or the other.
I don't know which state is getting it or how that dynamics works, but I'm just talking about that. I don't think that the private sector is cornering any more than in fact, we have capacity, and we're going to run out. In 3 days, we're going to run out of our supply if we don't start getting more.
Right.
So everyone is facing the shortage. And I think that what we have to focus on is that supplies from India are not enough. We have to be thinking about clearing those parts to be able to import in large quantities, which are available around the world.
Sure, and which is what now the government is stepping up to do. But I think that's something which, and I'm going to quickly get everyone's views around the table on this, is that it's crucial, is it not, Dr. Joshi, that almost every state now is coming out and telling the center, scrap this multi-tiered policy, just centrally procure and distribute. That is of the essence, is it not, Dr. Joshi?
Absolutely. I think we need to just have a single portal for within India and outside India import and whatever is homegrown, and then distribute it in an equitable fashion. And I think that's probably not happening. And we need to do that on a very, very fast track basis, ASAP, if you ask me, because that will ease out the uncertainty which is there, various stakeholders, and that will make life a little more easier, and it would be definitely a little more equitable. I think the private sector definitely is doing their job, and it's a welcome thing. They are also handling corporates to a great extent. A lot of corporates, so the economy is kick-started. So that's a very good thing. That if that is not touched, at least the state and center all should be procured by a single portal. And I think that is something.
Right.
I just had a point, Srinivasan.
I think Shobhana Kavineni just wanted to come in there quickly, and then I'll come back to you.
Really quick, I do agree with your last statement that the state and center should be one. But I think that it's super important that we continue this drive of and inject more. So when there's a supply shortage, that's when all these problems come up. But believe me, we all will be on a very different track 2 months from now when there's going to be an
things are better.
Of course.
But is that, Dr. Mulial, would you also agree that till such time as the shortages are sorted out, this multi-pricing, multi-tiered, fragmented system of vaccine procurement needs to go?
I think all I can say for this is I'm quite disappointed with the way we have so far handled the situation. Period. I don't want to comment anything more, and it is embarrassing. I'm sorry about it.
Okay, that you said all you could without saying one. Vikram, you also agree that this is untenable the way it's going on right now?
Yeah, I have nothing more to add. I agree with everything people have said. I think vaccination is a public good and fundamentally should not be left to market mechanisms. It's ironic, actually, Srinivasan, that even the fact that we have a private out-of-pocket expenditure a system for vaccination in India contrasts dramatically with the rest of the world, where actually governments are in fact incentivizing the giving of vaccines. For example, in the US, many states have prizes not only are the vaccines free, but actually there is money being poured into people to actually get the vaccines. Because it is a public good, because this is how you reopen society, because this is how we can climb out of the hole that we're in right now.
I know, I saw, and then Biden was saying something about get a beer, get a vaccine, get a beer.
Well, it's not just the US. In many countries, this idea of incentivize, and there's a whole science of how you incentivize people. The whole idea of conditional cash transfers it's predicated that when you give people money, they're actually incentivized to undertake behaviors that are in their own interest, but also in the case of vaccination, of course, in everyone's interest.
Okay. Last quick comment.
Supply,
yes, Shobhana.
We'll have to do all these things. When there's an oversupply, we can do all these things.
Yes.
But at this time, no one who's coming into our hospital and having to pay that is actually cribbing because it's desperation. I don't agree with it. I agree that with Dr. Mullah, but still, we're in such a desperate situation. So whoever can get vaccinated, let's just go for this and make sure that we have an oversupply, then move into this incentivization to come in and get a vaccine.
Right, of course. Yeah, that's when you really have enough stock to go around. Last comments, Dr. Mulyal, just looking ahead now, what is your sense? Do you believe that, of course, this wave seems to be, hopefully, fingers crossed, somewhat receding, but again, given this somewhat of an uncertain situation with vaccination, what is the likelihood of a third wave? And what would
after the
wave
last
look like, if at all?
This time, the attack rate has been quite high. And we don't capture the true nature of the infection or the incidence of disease at all. We don't have the capacity, so we have to make guesswork as to how many are infected, how many still remaining. But roughly speaking, it is quite likely that the population who is still susceptible, not yet infected, is shrinking very rapidly. Okay. And based on that, my assumption is that India is sort of reaching a point of safety, that means the buildup of immunity is sufficient to prevent a wide-scale, nationwide third wave. Here and there, where areas are localized and have low infection rate, there may be outbreaks. But nationwide, I don't think. But that is a statement I am making based on very, very rough estimates of our infection rate.
Okay.
ICMR is going to start a sero survey. I hope we get better, solid results on that.
Okay. Well, fingers and everything crossed that your estimates hold good. But let's see how it goes. We are clearly at an inflection point. But it's been fascinating. Thank you all so much for joining me on Reality Check. Completely out of time. Thank you also so much for watching. Good night.